Hi, I'm Marty Salt, and you're watching WFTV.com's Care Connect. Cardiovascular diseases are the leading cause of death for both men and women. Fortunately, there are many treatment options available and more information about prevention. Here to tell us more is Dr. Hafiz Hussein, an interventional cardiologist at HCA Florida Lake Monroe Hospital. And welcome. Thanks so much for being with us.
Thank you.
Now, we hear about this all the time. We've heard about it all our lives, but let's go over some basics because it never hurts to do that. And basically, what is cardiovascular disease?
Cardiovascular disease is an umbrella term, and it comprises of diseases that affect our heart. Heart is essentially a centralized pump in our cardiovascular circulatory system. And diseases of vascular system, and vascular system consists of arteries. These are the blood vessels that take blood from the heart to the organ or body, or bring it back from the body to the heart so heart can effectively circulate. Examples of cardiovascular diseases could be myocardial infarction or heart attack, where one of the blood vessels in the heart gets clogged up, cut down the supply to the heart muscles, and patients experience chest pain. The other group of diseases could be valvular heart disease. Valves are essentially the doors of the heart that make sure that the flow is unidirectional. There could be diseases of those valves. There could be problems with electrical systems of the heart. There could be congestive heart failure, and that is when heart cannot effectively pump. There could be varicose veins. Those are the diseases of venous system, of cardiovascular system, or even stroke. Those are all included in cardiovascular system.
And what are symptoms of all of these things going on? Now, we know if somebody's having a heart attack, we know chest pain, that's hands down. But just overall, what are symptoms that people should be aware of in themselves and others?
Sure. Most of the symptoms, let's say, it depends on what type of disease they are having. Let's say if someone is having myocardial infarction, or commonly we call it heart attack, they will be having some chest tightness, discomfort, indigestion, shortness of breath, or dyspnea. If they're having problems with electrical system of the heart leading to arrhythmias, they may have skipped heartbeat or palpitations. If they have congestive heart failure, mostly the symptom is trouble breathing when they walk, or when they lay flat at night, they become out of breath. Other symptoms, for example, varicose veins, there are swellings in the legs, and stroke usually presents with numbness or weakness in part of the body.
And how exactly do you diagnose cardiovascular disease?
Great question. So at HCA Florida, we start with comprehensive evaluation for cardiovascular diseases. We start with history taking. We listen to the patient and we want to know what's bothering them. Then we perform physical examination to find objective evidence of any of those diseases. Then we run variety of testing, starting with non-invasive testing, for example, an EKG, an ultrasound of the heart called echocardiogram, a stress test, or a CAT scan, and also ultrasounds of different vasculature systems, for example, venous ultrasound, arterial ultrasound. So we do all those testing to diagnose the disease.
And when you find blockages, what are the options? What do you do?
So when we have, when a patient has a blockage, we put them on medical treatment. The newest medications we place them on, and if it still does not help them, then we can perform wide variety of procedures. Those procedures include where we can put a balloon in the blood vessel, open the blood vessel, and also can put a metal scaffold in the blood vessel, and that's called a stent. Certain patients require open heart surgery, or called CABG. And it's interesting that, at HCA Florida, we have the smallest heart pump available, and we are able to perform very high risk and very complex procedures to take care of our patients that was not previously possible.
And people are aware of, they hear about healthy lifestyle, but what do you say are the top ways to prevent heart disease?
Sure. So American Heart Association recommends, that you get good night's sleep, you have good physical activity. You don't have to run marathon every day, but 30 minutes walking 3 to 4 times a week, a brisk or fast-paced walk is enough. Eat healthy, do not use tobacco, manage your weight, and control 3 things. One of them is your blood pressure, second is your blood sugar, and the bad lipids. If you follow these 8 activities, that's a very good preventive or prevention strategy.
For a lot of things,
yes.
Not just heart disease, all sorts of things. All right, thanks, Dr. Hussein. And if you would like to learn more about comprehensive health care and emergency services available in your area, visit HCAFloridaHealthcare.com. I'm Marty Salt, and thanks for watching.